Huples Cat! Welcome to the Prepper Book Club. On this great book, we have finally reached chapter 5. This is on first aid and hygiene. I'm going to point out what I see as errors, and you may or may not agree. So they must have meds. Loperamide, yeah, I get that. But know the cause of the diarrhea or nausea before you just start treating it. For certain types of diarrhea, if you actually give them stuff like loperamide, you'll kill them. Hydrocortisone cream, yeah, but baking soda paste works just as well and is a lot cheaper. Ivermectin, no and yes. Ivermectin is toxic to humans. In a pinch, if you've raided pet supplies, I guess you could try it. But to actually go out of your way to have ivermectin for this use? Ridiculous. Don't be like Donald Trump. Be intelligent about your first aid supplies. Diphenhydramine. Absolutely, yes, you must have this. You get them. It's an essential med for me. The nausea and diarrhea absolutely needs to be treated. Now, antibiotics is definitely yes, but you really do have to have a good drug book. Doxycycline should not be used more than 3 years past expiry, ever. The others mentioned can be used cautiously for 10 to 20 years, providing you're not giving them intravenously. As I mentioned, the other medications listed on pages 302 to 303, far too much stuff, no chance for most people to get it. I actually have that and more, but then I'm crazy, and I also worked at a hospital. If you actually are able to get hold of IV antibiotics, figure it out, use a drug book. Can you actually inject them in the outer upper quadrant of the backside? It's going to be a lot safer than trying to give them IV, but you're really going to need a drug book for dosing. Now this is where I have to wonder about Selco and Gowan. I really have to wonder how their thought process are working, what they're actually doing. They recommend you start, get this, anti-tetanus treatment. Really? I find it very hard to believe Selco has this at its bug out location. A lot of the other stuff that they recommend is going to kill you easily without a bit of knowledge in a disaster. Now having multivits is great. Have a few years worth stocked up. Now like everything else, it may be a daily dose of multivits. You'll take it every 2 to 3 days daily for when you're feeling ill. Page 305, Selco talks about using red paint on your hands on the casualty. So if you touch the casualty, you get red paint on you and you can spread it everywhere. As long-term viewers will know, what I recommend is sticky jam. The person is covered in sticky jam. They have sticky jam all over them. You don't want to get it into any of your orifices. If you get the sticky jam on your hands and your skin's intact, just wash it off. This list to me reads like somebody's gone and looked for every single list of first aid supplies in a disaster they could find and added them in this list. Endotracheal tubes to intubate non-breathing casualties have no place in epicidal fall, none at all. Sure, you can have tons of oxygen tanks and nebulizers and masks and humidifiers and everything else, but realistically speaking, how are you going to use them? How are you going to pay for them? How are you going to get them prescribed? And how are you going to safely use and store them? And they're going to be single use. You might want to get a little oxygen concentrator that's going to give them a little bit of extra oxygen rather than invest a lot of time in single-use stuff that's not going to be of any use during SHTF. I mean, this is just ludicrous. Sets of comb tubes, easy to intubate with these, some restrictions, laryngoscope not needed. Yeah, okay. And then what are you going to do? They don't actually mention having a ventilator. And this stuff is really high-end, and I really concentrate on having adequate bandages and ability to clean and sterilise wounds. That's what you need to be focused on. Again, if somebody's got a spinal cord injury in SHTF, they're going to die. Let them die gently. Again, CPR is not something I recommend you do in a disaster situation. You might want to try it if it's your loved one, but what do you do if you get them back? Probably nothing. People are having massive hemorrhages, they're going to die as well or get septicemia. Sure, you can use tourniquets, etc., etc. But focus on basic stuff here. Finally, on page 326, Selco does do this. He talks about not cleaning wounds. Yes, people can get septicemia and they're going to die. A small skin tear can kill you. It's highly unlikely if you're feeling fit and well and have a good immune system. In SHTF, it's highly unlikely that'll be you. Having decent work gloves is essential to prevent injuries to hands, as is having decent footwear and clothing. Now they talk about suture kits, and you know this is called stitching to most people, and yeah, this is what you might want to use if you're going to suture somebody. You don't actually need to use a needle driver, but you know, you might want to get one. If you're going to have an irrigating syringe and you're going to use clean water, make sure it's sterile clean water. As people who've seen my recent video on my backpacking first aid kit, I've got 3 absolutely different types of suture in there. I know what they do, I know when to use them. Again, a suture is not just a suture. What most people are going to be better off doing is using something called steri-strips. Using steri-strips is probably the best thing to do. This is a picture of how not to use steri-strips. You might as well just got one big plaster and shoved it on. This isn't going to do much at all. And because it's in the hand and the hand has not been splintered, they're going to rip apart almost immediately. Total waste of gear, total waste of time. This is not how to do it. If it's a flexible joint that's been cut, you have to immobilize the joint and or use actual sutures. Now a bit of history. When I was 19, I had to put my first abdominal dressing on a patient, a post-surgical patient who had quite a large incision. It took me a few hours. I was terrified, trying to practice all of the sterility equipment I was told, doing it right, doing it correctly. When I called the sister over to check my work at the end of it, I was very proud. It was beautiful. She took one look at it, ripped it off and said, "Do it again, you use far too much stuff." I'd put dressings like this to cover it on instead of going around the edge. I'd used too much material. And although that was a waste and it was actually risking the patient's health, that's how we learned things in the 1980s. And I never forgot that lesson. Use the least amount of equipment that does the job. In the aftercare section on 329, they talk about what to do if the wound's infected. And this is not what you do. This is what you would actually do. You remove alternative sutures or alternative steri-strips. So 1, 3 and 5 are removed. You wait 24 to 40 hours and you remove 2, 4 and 6. Any areas of the wound that appear gaping should be opened up completely, fully cleaned with sterile water, not clean water, and you might want to consider antibiotics if they don't start responding or if there's tracking around the area. Selko and Gowan recommend that you use IV antibiotics, and so do I. Good luck being able to do that in a societal collapse. Figure out what a societal collapse is actually going to look like before you start telling people what to do in it. Going back to the primary assessment on pages 310 to 314, they use DRAB-C, Danger Resuscitation, Airway Breathing, Circulation, CPR. Looking for danger before you start treating is absolutely critical in any situation. In a societal fall, you want to have a really good look for danger and you want to wait before you intervene. Is this casualty actually a casualty, or are they bait? Are you going to get shot or blown up if you approach the casualty? This is not the now. This is not normal. Get this in your head. You need to scout the area from at least 2 positions before ever approaching a downed casualty. And you want to really consider why you're approaching the casualty. Most likely, it's just to grab whatever stuff they've got that you need and run off. Treating them and waiting for an ambulance in a societal fall is risky and probably silly. You never ever become injured trying to help the injured. If you're in a multi-casualty event, which they talk about, it's going to be situational. How do you assess? How do you treat? You're going to use triage. Can they sit and wait? Can they lie and wait? Can they lie and be treated? Not treating them because there's no point? Or can they be injured and actually be helped? Learn about the recovery position and use it. See if you can find anybody else around to look after some of the casualties. As I've said before, CPR is likely not warranted in a condition of SHTF. Having used DRAB-C, which they then call Dr. ABC, what they actually then do is actually tell you another order, just to confuse you even more. But they don't give you an actual anagram for this, so that's nice. What we're going to do here is we're going to look for danger, we're going to plan before acting, we're going to observe, we're going to R for react, R for response, look at the airway, and use recovery position. Very confusing, no point to this whatsoever. The huge amount of time Selko and Gowan are spending in this section on airway and circulation and trying to start them again if they've stopped is totally pointless. My advice to you in SHTF is treat those who are injured, who have a heartbeat and who are breathing. If they're having massive hemorrhage or have huge wounds from burns or crush injuries, don't treat them. Focus all of your energies and all of your gear on treating survivable injuries that are survivable without hospitals, without ICUs, without ventilators, and without advanced life support. On pages 330, they spend very little time talking about burn victims. Remember, major burns will increase pain and death. They do make the important point that all burns victims should be stripped naked and have all jewellery removed. Heat can have secondary thermal injuries from burning clothing or hot metal on them. A major burn is going to be untreatable by you. Somebody with massive amounts of burn injuries and deep burn injuries are not treatable. They're not going to survive. Any burns of joints need highly specialised care. Again, you should have read up on this, and this page in this book is not going to help you. Again, for major burns, we absolutely blur what SHTF is. First of all, remove the victim from the burning area. Yeah, without getting burnt yourself, I agree with that. Remove any burning material from the casualty. I don't agree with that. Strip them naked immediately. This is where we get silly. Call or send for help. Oh, okay. Help me, I've got a burn victim here. Well, society's fallen, so that's not going to be very effective, is it? Then you're going to get them to a safe place. Well, how are you going to transport somebody with a massive burn? Then warm and still. Well, that's a good idea. Try to wrap the injured areas in a clean sheet if available. No, use a sterilised sheet. You can put white linen sheets in canning jars and sterilise them. If you want to treat burn victims in SHTF, you should be set up for this. They talk about a whole bunch of stuff. Really skipping over what to do with small dressings. Really skipping over what to do with small burns. They recommend reasonable treatments, but honestly, it's the physiotherapy the person's going to require afterwards and the pain control that's going to be the big problem here. If society's fallen, hopefully you know some gang members. Hopefully you can get hold of some meth. Patients with major burns are going to be in absolute agony. If you can make ether, You might want to make it for major burns patients to let them die comfortably. Do you want to be awake when somebody's rooting around in your abdomen trying to find a bullet? This is pertinent to burns, but on page 339 they talk about fractures and sprains and how to immobilize. Get all the rings, the watches, the bracelets and piercings out and off immediately. Tissue is going to swell with both burns and with tissue injuries. Spend a bit of time on page 341 talking about shock. Basically you want to treat low to moderate shock. If you have to deal with severe shock, and there's various different types of shock, as this excellent book points out, they're going to die. In SHTF, you don't have modern healthcare. Somebody in massive shock, septicemia, whatever the cause of the shock, is going to die. Again, you can try rectal hydration. It's an important and easy to use skill. It may well help. On page 347 they talk about anaphylaxis. Again, if it's mild, you can maybe give some antihistamines. If they have severe anaphylaxis, they're going to die in SHTF. Sure, if it's a bee sting and they happen to have a functional EpiPen, you're going to be able to save them probably. But again, setting yourself up to treat severe anaphylaxis that results in hives and death isn't going to work in SHTF. It's a misdirected effort. The chapter ends on page 350, and this is how it ends. Refer the casualty for further treatment if they develop any other symptoms, signs or infection. Society's fallen. Who are you going to refer them to and how? You're the hospital, you're the doctor, you're the nurse, you're the coroner. Get proper wilderness survival training and proper wilderness survival first aid training. Easily available online. You can even buy books on it. Using prepper books like this to prepare for first aid in society's fall is not a good idea. Well, that's it for me. I'm thoroughly enjoying reading this book again. I do think it's a good book, and I'm looking forward to seeing if anybody else out there in the prepperverse is actually able to produce a book that has got the same intent as this, but doesn't ramble on about absolute nothingness. Oxygen tanks don't have a place in prepping. If you disagree with me, and I'm sure you do, tell me why. Let's have a discussion. Have a great week. Toodles. This has been a Sleepy Terrier production 2025. You lot still here? Remember, elbows up, fight tyranny.